this is your Houston chiropractor, Dr. Gregory Johnson, and we have Isaiah with us here today, who is actually standing up on his own today versus the first couple of times we met him. He came in here on crutches and could not even stand up on his own, couldn't get out of the chair on his own, and has severe low back pain and spasm and leg pain, sciatica, from a huge herniated disc in his lumbar spine at L5S1. So we're going to adjust him and show you how we helped him get rid of that after 2 visits. He came in the following Monday after his first 2 visits without crutches and walking and had a better weekend. But I'll let him tell his story after we get done. So let's take a look here first. So we're going to check his posture like always. So have you flex your head forward and backwards for me there, Isaiah. He's got good range of motion in his cervicals right now. He's got tiny bit of a little forward head posture, but it's a lot better than it was. A little bit of right translation of his cervical spine and a little left translation on his pelvis still, but he doesn't have any rotation like he did the other day, so he must be sleeping on his back more. Yep. Yeah. So he's following the recommendations that we're giving him, and he's actually getting better quicker as a result of that. And the patients who actually do the home exercises and things we talk about, like sleeping correctly, sitting correctly, and standing correctly, all those things, they get better a lot quicker. Okay, Isaiah, let's lay you down here and decompress you first. You guys should be able to hear this a lot better. I got a new wireless audio Bluetooth device, and new video, so should be having better quality videos for you to watch in the future here. And we want to thank you all for subscribing and watching and commenting and sharing our YouTube videos. You guys have been great. We appreciate you. And if there's any conditions that you want to see talked about or discussed or treated while we're doing this, leave those in the comment section on this video. Okay, take a nice deep breath through your nose like this. Let it all out and relax. There we go. There we go. Good. You feel that all the way down?
Yeah.
Yep. Okay, so we have decompressed his spine from the occiput all the way down to his sacrum. And you should have seen his eyes the first time we did this. They got about big around as a plate. But felt better afterwards, didn't it, Isaiah? There you go. Very good. And that was a standard Palmer master cervical rotary break, and he's moving great. You should be able to hear those pops a lot better for all you crack addicts out there. Okay, let's come over this. We got a lot of people that love to hear the cracking on the audio, so there we go. And by the way, we did get you guys' comments on some of the things you wanted me to show, which one of them was the ankle adjustments and knee adjustments. So I'm going to show you those today. Now that's, legs are even, that tightens up a little bit at the very end, but nothing like it was at first. I'm going to take your shoes off here on this. We're going to start up here in his sacroiliac joints on the right one first. He's got a little internal rotation and posterior rotation here, so that's a PSIN in Gonstead listings. And now I'm adjusting his sacrum on the right side, straight superior to inferior. Sacrum on the left side, straight superior to inferior. And the reason I do this on the y-axis like this is to separate the sacrum from the pinched nerve held L5S1. And then now we're going to adjust the left SI joint. There we go. And I've also got my hand on his greater tuberosity trochanter on his femur here, so we're actually adjusting his hip joint here at the same time. Yeah, I'm still got to get this right SI joint back in place. There we go, better. That's it. Now, we're going to get L5 on him, which is the culprit right here. There we go. There we go. Also, Isaiah left us a very, very good 5-star Google review recently, which you can read on our Google Plus page. Advanced Chiropractic Relief, or you can just type in Houston Chiropractor, and then when you get to Advanced Chiropractic Relief, it'll say reviews, 26 5-star reviews. So we're very happy about that. The best thing about it, though, for me, is seeing it change people's lives like it is Isaiah's here. I mean, he was looking at surgery. He'd been doing medication and prospect of having all these injections and then surgery. That's the only medical treatment for what he has. And he elected to get this done naturally and let his body heal itself, which it has been doing and will continue to do. There we go. So I'm adjusting all the way up to L1 there, and now we're going to get down to his lower thoracic. So I'm going to open these joints up a little bit. There we go. That's about T10, T7-8, T5-6, and up here is T3-4, and I'm going to get a little higher and see if I can get T1, T2 here too. I'm going to do that with the thumb move. Okay, just let this head relax in my hand. There you go. Good. Okay, that one's tight. So he does have some trigger points in his trapezius muscles right here, which we're going to put some direct, steady pressure in. This is called Myofascial Release trigger point therapy. Trigger points are a buildup of metabolic waste products that form from just normal cellular metabolism, but because the muscles are so tight, they won't let the blood carry out the toxins, so they build up in here in these knots and become very tender and sore. The only way to get those out is to actually work on them really deep to accomplish that. And we've done the same thing down in his lower back, and I use my elbow down here to get a deep, steady pressure on it, and I want to have the patient just continue breathing. Breathing is a really crucial aspect of getting well. A lot of people don't breathe properly. They hold their breath when they're hurting. That's kind of a natural defense mechanism, but it actually creates more pain and problems. Now, this was like a rope, but this is softened up since we did it last time. I get all the way up into the thoracolumbar region because this area is always compensatorily very hypertonic and tight after you've got muscle spasm in the lumbar spine. So he should be even now, which he's pretty close. He's only about 1/8 of an inch off on the right, but when I bring him up, they stay even. Is there any tightness or pain there, Isaiah?
A little.
Tiny bit in the low back? Okay. So I'm going to hit his sacrum again on the right there, in the center, right there, and then I'm going to get L5 there one more time. Okay, that's even now. And how's this feel versus last time, Isaiah?
Definitely.
Is that a little easier?
Yeah.
Okay, good. So we've already done the really deep tissue on him, so I'm not going to get the turbonator out on him today. We're going to use this genie rub to get some deep vibratory percussion down into the tissues, which will help increase the blood supply, help them heal quicker, stimulates the nerves and the muscles to relax. And most importantly, it improves the blood supply to the region and helps with myofascial release. These areas that I just dug in on with my elbows and my thumbs, we want the blood now to come in here and carry out the metabolic waste products so he can get rid of those toxins, and that'll make him less sore and he'll heal quicker. We always advise our patients to drink about 1 gallon of water a day. Water is super important in the healing process. So many people are underhydrated, and when you're underhydrated, you get a condition known as dehydration, amazingly enough. And when you're dehydrated, your body does not function at its most optimal level, so We always have our patients who improve or increase their water intake when they start their treatment. And then we work on the fascial or the IT band over here. Every single patient that has pelvic and lumbar spine problems has very tight IT bands or fascial muscles, hamstrings, all the way down into the calves, which is made up of the gastrocnemius and the soleus muscle. Gastrocnemius is more on the outside here, soleus is on the inside right there, and those are pretty sore. Especially when someone's got sciatica that goes all the way from their low back all the way into their feet. As you can tell, that's got a really high RPM. This should feel even easier to you guys, this.
Oh, yeah.
Better that time? Good. Okay. So let's turn you on your back now. And now I'm going to show you the different ankle and foot adjustments that we do. The first thing that I do is I just get a really good kind of range of motion feel down in the lateral aspect of the foot here, and then we get a straight decompression type of pull on the digits, the phalanges are called, the toes. You got the metatarsals, tarsals, metatarsals, and then phalanges. So right here I'm adjusting the talus, and I internally rotate it and pull straight down. You felt that pop right there, didn't you?
Yeah.
And you probably felt that all the way up in your low back even.
Mm-hmm.
There we go. Same thing there. That was talus. I actually got his big toe to move a little bit more on that one as well. So on the knee adjustment, I check for medial and lateral play here. He has a tiny bit, not much though. So get that in there. I internally rotate the leg so that I get an internal rotation on the hip here, and then I just do a straight decompression in the knee. It separates it and then reseats. And when it reseats properly where the femur meets the tibia. Now he's got a lot more play on this left or right knee, I mean. There we go, and a lot more movement too. Should have felt that in your knee and back as well.
All the way up, yeah.
Good. Okay, let's sit you up and face towards your knee sideways, remember? And we always have our patients get up sideways, not sitting straight up, because when you sit straight up, the vertebrae have a tendency to go backwards, or retrolestes. That's where the nerves are, and that's what causes the pain. So we're just checking his shoulder range of motion, which is very good. Adjust his shoulder into the glenohumeral joint, which is the ball and socket. You got a little crepitus on this left side. That's the popping and grinding that you feel. There we go, good. Alright. Just his elbow, where I'm getting the radius and ulnar line back up, along with the olecranon process and the humerus. And then we adjust his digits here as well, and the fingers. Here we have the carpals, and then the metacarpals, and now phalanges. Same thing over here, radius, just his elbow, the carpal bones, excellent. There we go, good, okay. Now, Isaiah, would you mind sharing with our YouTube subscribers and viewers, tell them how you came in here, and what brought you here, and what you've done previous for this?
Yeah, absolutely. As Dr. Johnson said, the first time I came here, I was in crutches for, oh my God, like 5 weeks probably. And then the pain was horrible due to a herniated disc, like he said, and my sciatica nerve was killing me. Painkillers didn't work at all. I was actually going to a chiropractor before. I also did acupuncture. I think I mentioned that didn't help.
And they did that twisty adjustment on you too, right? Where they put you on your side.
Yeah, but that didn't help
and
at
that
all.
Didn't help, right?
So my doctor suggested surgery, which is something that I wouldn't consider unless it's very necessary. But thank God I found you, and after the 2 visits I came here, I was able to walk again. And I'm so glad now that I'm back on my feet very much. Still a little, pain here and there.
Yeah.
And I'm able to sleep.
Well, like you said in your review, you're a little work in progress, but we're over the big hump.
And I'm swimming, so I'm doing, trying to...
Non-weight bearing compression, which we also recommend as exercise.
So that's been helping a lot too. So
Super.
Every day I feel like getting better, especially when I come here the next day I feel so much better.
But you're participating too, and that helps. You're doing your homework,
Absolutely,
your home exercises, and you're swimming and doing all the things we talked
as
about.
much as I can, but thank you, for all you've done for me. So
Absolutely welcome. Thank you for sharing that with these people. All right, let's come over here. We still got to shoot him. On this last one now, we're going to actually help reteach his cerebellum through neuromuscular re-education. I'm going to adjust the atlas on the x-axis and send messages into his cerebellum, which controls balance, posture, coordination, and all kinesthetic movement of the body. So let's have you close your eyes again and flex your head forward and backwards. Now see, his posture is excellent already right there. So let's pull these guys back. The biggest thing that we're doing with Isaiah right now is still getting his head back up over his shoulders, but now shift that pelvis way right. Because his is translated left, so we do exactly a mirror image of that. And he pushes his pelvis way out to the right. There we go. Yeah. Let's have you relax and close your eyes again and flex your head forward and backwards. This should feel smoother to you, Isaiah. Did it? Yeah, take a look. See, his posture from the side view is very good. His ears hanging pretty much over his shoulder. His hands are at his sides where they're supposed to be. He's still a little bit left, but not as bad. So we'll continue working on that. Isaiah, glad you're on the road to recovery.
Thank you so much.
And thank you for that really great 5-star review you gave us. And this is your Houston Chiropractor. We'll see you next time.